Everybody hold on. Thanks for being on time. Most of you.
5 minutes doesn't count.
All right, well, thanks for coming. I know your guys' time is valuable, so we're gonna get started here. I just want to introduce myself real quick. My name is Dr. Dave Boynton. I'm a chiropractor and specialize in functional medicine. This is my office. So we're talking about, obviously, integrative approaches to breast health. And we also have a couple other people who are gonna come and talk behind me who are experts in their field as well. So please try to hold all your questions till the end. We definitely want to answer all the questions and make sure you guys take advantage of the free sauna that we gave everyone. So if you didn't get those coupons, pick one up before you leave. So this is what you need to know. This is what we're talking about today mainly. So what should you be concerned about breast health, signs and symptoms associated with poor breast health, what you can do to improve your breast health, what does your teeth have to do with your boobs? That's a good question. We'll get to that. What are endocrine disruptors, inflammation, how bad is it for you, and then what can you do about your health? Because you are in charge of your health and your daughter's health. So all this information that you women know, if you have daughters, it's important that you educate your daughters on how to have healthy endocrine health, breast health, reproductive health. So breast health starts off with the health of your grandmother and the health of you, because whatever is in your grandmother is in you, and whatever is in you is in your daughter. So it really goes back because chemicals, food additives, all those things cross through the placental barrier. So kids born these days have 245 chemicals in their body before they take a single breath, and most of them are endocrine disruptors. Those are things that mess up your endocrine system, which has to do with your reproductive health and your breast health. And then if you can nurse, fantastic. If you can't, or you have supplement, you have to use formula. And formulas are not all the same. Yes, they're all in a powder. They all come in a canister. That's really the only way they're the same. So if we look up here and see what American baby formula looks like compared to the formula for the rest of the world, you can see it's very, very different. So they found heavy metals, preservatives, soy, gluten, mineral oil, GMO, fake iron, synthetic nutrients, and corn syrup added to baby formula. So basically it's the same food we as adults eat, just in a powder form. European formulas, obviously they use organic materials. They have all organic things. They use goat milk, which is much closer to breast milk than what cow milk is. They're all gluten-free. They're always non-GMO. They have no heavy metals in them. They have no preservatives. So if you do need to buy formula and you can get it from Europe, that is definitely the way to go. And obviously, breastfeeding is the best if you have the ability to. If you can't, I know sometimes that's not always an option for women, but it's really important that you start off your children as healthy as possible. So, so what are other things that we put on our bodies that can impact our breast health? So suntan lotions, bug sprays, juice, poor indoor air quality, non-organic foods, all those things can really impact our children quite a bit. So when you have little kids, do not get brand new carpet. Why? Because your little kids crawl on the carpet, and all that carpet outgasses, and they're right there on the carpet. Hardwood floors are the way to go. Organic furniture, sounds weird. Organic furniture doesn't have fire retardant. Fire retardant is in our clothes, it's in our furniture. That impacts your endocrine system. The foam in your cars, the upholstery in your car, you know, when it's really hot in the summertime and you open your car, it's like that weird smell. That's poison, basically. Let the poison out of your car before you get in it, because all those are all the plastics and polymers are heating up over time. And so if you jump in there, you're just getting a big face full of that stuff. And it's not that it happens once, it happens over the course of your lifetime. Those are all things that just add up day after day, and can cause poor breast health or cancer of any sort at all. And when you have certain genetic polymorphisms or mutations, your body doesn't get that junk out like it's supposed to. And most people don't even know that they have these genetic mutations because their doctors, in all their wisdom, don't think it's important. I do, they don't. So what are some causes of poor breast health? Obviously, I'm not going to read this whole thing to you, but you can see there's a long list of things that you can't control. Some of these things, they're just in your environment. There are things you can control, like don't smoke. Duh, don't smoke because it's bad for you. But things that outgas, you can't really control that. You can't control the lotion that you use or don't use. You can control ultraviolet radiation. You can control buying organic things. So do that as much as you possibly can. And your genes, not your genes, I was being clever, I thought anyways, can impact that. Nutritional deficiencies, you can control that. Processed foods, you can control those things. So because you can't control those things, using a sauna as an example will improve your breast health because you're going to get toxins and stuff out through your skin. Your skin is the biggest detoxification organ that you have. It's also the biggest organ that can also receive chemicals that get through your skin into your body. So your skin health is very important for your overall breast health and your overall health. So what are some symptoms associated with poor breast health? Obviously, if you have pain in your breast tissue, that is not normal. Fibrocystic breast tissue is also not normal. Dense breast tissue can be normal, although some doctors would disagree with that. Obviously, other things, if you have a change in your nipple or it becomes painful, the color of your breast tissue changes. If you have any leakage from anywhere in your breast, not only your nipple, but anywhere else, that's obviously a bad thing. If it's hot, or if one side is larger than the other, those are all problems. Those are all problems that there's all signs that there's obviously an ongoing problem. Weight loss. Most women want to lose weight, but you shouldn't lose weight when you're trying to, not when you're not trying to. That can be a sign of having some sort of a cancer in your body. Difficulty breathing, and then fibrocystic breast tissue. Do you know, anybody have fibrocystic breast tissue? Sore tenderness in the outer portions of your breast. That is typically iodine deficiency. So your breast tissue, your uterus, and your thyroid need the most iodine of anywhere in your body. And that freaks out some doctors and some women, but that's a common thing that can be completely fixed with a good old iodine supplement. What do your teeth have to do with your boobs? A dentist figured this out, which I thought was pretty cool. So he noticed, so this is Dr. Rao noticed that in 1958, he had 150 women who were treated for breast cancer. He found 147 of them had the same tooth removed on the same side that they had breast cancer on. Because in Chinese medicine, the meridians go from your teeth down to the breast. So when you disrupt the mouth, it can impact your breast health tremendously. Interesting. And Weston Price says 100% in that same meridian. So which tooth is it? There you go. Do they have copies of this?
Yes, in your folder.
In your folder, you should have a copy of this. So if you don't know, it's going to be in your packets. So it's going to be, so the right side will be number 4 tooth here.
If you, it might be a bit small, so you might want to take a picture of that.
Yeah.
You will need to refer to that later.
So tooth number 4 and tooth number 13. And then 28 and 21. So your teeth impact a lot of your health. Is that the right chart? Because I know.
I was wondering, she said it was small, but this is big. But
Okay.
Is it not the
Some
same?
of them have the big one in them.
Okay. And I know one time we put the wrong ones in there too,
Yeah.
so. Okay. So it's in there. So it's your teeth are way more important, you think, not just for chewing up stuff, but it's for your overall health. Your mouth actually has a lot to do with your health. So there's actually a functional medicine marker that we can look at called TMAO, which has to do with mouth bacteria that actually can increase your blood pressure. So a lot of patients we've found that have elevated blood pressure, they need multiple medications for, have elevated TMAO levels in their blood, which tells us their mouth bacteria is out of balance, and we fix that using resveratrol. So it's not something we kill, we have to support that with antioxidants. So there's lots of cool things we can help, a lot of interesting things that your mouth can really help with that can improve your overall body health. Endocrine disruptors, I've already kind of touched on endocrine disruptors a little bit tonight. So your endocrine system for men is pretty much their prostate and their testicles and the pituitary gland. Women, pituitary gland, breast tissue, adrenals, ovaries, and uterus. So chemicals can mimic hormones in your body, and what they do is they produce excess estrogen. So estrogen dominant cancers for women, breast, ovarian, uterus, and vaginal cancer. Men is prostate cancer. So anything that causes your body to produce estrogen can cause those things. Adipose tissue, your body fat also produces estrogen. Your body fat also produces inflammation. Inflammation is the root cause of all disease for the most part. So making sure you stay fit, making sure you detox out the harmful estrogens. There are certain genetic pathways that if you have mutations in, you don't do that as well as what you should. So we actually run tests on people to figure out, do you have these gene mutations and do we support those pathways appropriately? The main one is MTHFR, COMT, and MTRR. Those are all pathways we look at when people have history of cancers, and they almost always have mutations. The technical word is polymorphism. That's a lot of syllables, and I can't spell it, so I say mutation. So if you have these things, your body cannot get junk out that you can't control anyways. So you take certain supplements to help your body upregulate those pathways so that you can get these harmful things out of your body. So these are just some different types of endocrine disruptors. So things that you can control, cannot control. So what can you control from your food? Don't store food in plastic. The plastic's going to get into your food, so it's important you store things in glass. It's important you don't use aluminum foil. Aluminum foil, when you heat it up, the aluminum from the foil gets into your food. Aluminum is an endocrine disruptor. What else are endocrine disruptors? Deodorants, flame retardant things, toys, cosmetic, pesticides. They're really everywhere, but it should be a zero or a little bit in or a little bit out every single day. But the problem is we get that accumulative factor in our bodies. And then breast implant illness is also a big problem. We've had probably at least 20 women that we've encouraged to have their breast implants removed. They all developed autoimmune conditions. They all developed, almost all of them had fibromyalgia. I think there's about 6 or 7 of them that literally woke up and their fibromyalgia pain was gone. Now, that doesn't happen to everyone, but with some women, those things, think of a big splinter that's stuck in your body. Your body does not want those things in there. And it's not the fact that they're saline or silicone, it's the actual breast implant itself. The body actually puts a shell around it to try to protect the rest of the body from that thing. So it doesn't want in there. That's also an endocrine disruptor. Inflammation, as I mentioned before, is kind of the root cause of most all disease. So what causes inflammation? Your diet is a huge part of it. And what specifically in your diet? Gluten, dairy, peanuts, soy, canola oil, white potatoes, corn, alcohol, and sugar. So in a perfect world, we don't eat any of those things. Because this is not a perfect world, reduce those things as much as you can. Specifically gluten, dairy, and corn, and alcohol. Those are probably the top inflammatory things that are going to impact your overall health and your breast health. Underwire bras, that cuts off the circulation of the lymphatics to the breast tissue. So underwire bras are not the most ideal thing to wear. These women behind me will talk about those things later. Trauma, mammograms. Who's had a mammogram? I'm sorry. 22 pounds of pressure, 28?
Right around there.
Yeah, about 25 pounds of compressive force, that damages your breast tissue. So what should you do when you have damaged breast tissue? You should actually put radiation into it. What a good idea. It's like, I'm gonna punch you and then I'm gonna poke a needle into right where I punched you. That doesn't make sense. Thermography doesn't hurt you and you get way more information from it than mammograms, which actually hurt a lot. Obesity is also a big problem and that can cause inflammation as well. A bad attitude, believe it or not, causes inflammation in your body, and radiation from mammograms. These are common conditions associated with having, with the breast tissue and genuine fibrocystic breast tissue. Worse around your cycles typically. Caffeine can make it worse. Those are kind of little marbles that you kind of feel in the upper portions. Fibroadenomas, those are just tumors in your breast that are common as you age. Breast cancer prevention is obviously the best thing to do to prevent that. Hormone dysregulation, so having abnormal menstrual cycles from a period standpoint is also can impact your breast health. Breast implant illness, we talked about that. Toxic burdens. In 1974, there was 1,500 chemicals allowed by the FDA. In 2019, there was 15,000 chemicals allowed to be used by the FDA in everyday use. We are all exposed to over 1,000 chemicals every single day since the time you're born. That is insane. And they're all safe and FDA approved. Thank goodness for the FDA and their wisdom. to keep us safe. Hopefully you understood the sarcasm in my voice, so that it is your job to keep you safe. It is your job to keep your kids safe, because no one's going to do it for you. We can help tremendously because we are experts at what we do. Skin conditions are commonly internal problems, typically of the GI tract. So it's an overexpression of the immune system when we see rashes on your skin, things like that coming from the gut. And sensitivities to odor, sounds, chemicals, toxins, those are all signs of having an imbalance of your endocrine system and your nervous system as well. So what do we do about it? Because we can't control all these things, eat as much of an anti-inflammatory diet as you can. What is that? Paleo. Eat fruits, vegetables, and meat. If you don't want to eat meat, then don't eat meat. But try to get as much organic food as you can, because you really are what you eat. And what is inside your food, if it can impact you in a good way, it can also impact you in a bad way. GMO food is also, eating non-GMO food is also very important. Don't take, and it's important you take the right supplements. If you're buying supplements from Kroger's or Walgreens, I got a good deal, this is only $4. I'm like, that's actually hurting you. They actually have nutrients. They actually deplete your body of nutrients when you take synthetic junk that doesn't break down. I had a patient who works for a porta potty company. What a glamorous job that is. And when they dump them out, these big blenders basically. And he's like, yeah, like the Centrum, we hear Centrum vitamins going around inside those things. He's like, we've actually seen them that like the word Centrum is still engraved on them.
Oh gosh.
But they're FDA approved. They have awesome commercials. They're GMP certified. Ooh. Do you guys know what that means? That means the facility they're manufactured in is safe and clean. That's all that means. It's safe and clean. It doesn't mean what's in the bottle is actually in the pill. It just means they're safe and clean. Good thing, again, good thing the government's looking out for us. Thermography is a great way to show inflammation not only in your breast tissue, but in the rest of your body. Having a positive mental attitude is important for pretty much everything. Reducing toxins in your home as much as you can, and exercise to tolerance. Your body has to move. You have to move, you have to sleep, you have to drink water, and you have to eat healthy food. And if you can do a lot of those things, you're really going to improve your overall health as you get older. So again, that's me, Dr. Boynton. I'm a functional medicine specialist. And Debbie, who's going to talk, are you talking next? Yep. Debbie's going to talk next. She's an expert at nutritional testing. And then Jackie is here from Thermography. And you. And Robin is also here to talk about the mobile thermography unit that they also do. So I think that's it. Yep, that's it. So we're going to leave that up. And I'm going to turn it over to
Questions?
Debbie Belshaw. Any questions for me before I turn it on over? Not everybody at once. Yeah.
Tooth question.
Great.
In a panic moment, I had a tooth pull because I had aluminum or whatever the metal mercury fillings, and I didn't have a root canal, but I did have a tooth extracted on this side, and I'm wondering if that's going to affect my breast health.
Is it number 4? Is it one of the numbers from the chart in there?
I think so.
Okay. That
on my left side.
It's better than having a root canal.
Okay.
It's better than having a root canal, yeah, because the root's still there.
Okay.
So how much will it impact your health? My crystal ball's broken, so I can't tell you for sure. But if you do all these other really proactive things, you're greatly reducing your risk. That's really the most important thing, is don't look back and regret, but okay, if I made a mistake or not, who knows? But what can I do proactively on purpose to make sure I can reduce that risk? That's really the most important thing.
Thank you.
Yeah, absolutely. Anybody else? Yeah.
How do you, the TMAO level that you talked about for blood pressure?
Yep.
Is there like a test?
It's a blood test, yeah.
It's just a blood
Usually,
test?
I forget what it means, but I forget what it stands for. It's some big, long technical name.
Okay.
Yeah, you just order it, and if it's high, it's due to gut bacteria imbalance causing blood pressure. So when people have blood pressure that just cannot be controlled well with medication, that's almost always the cause.
Never heard of it.
Because I look at that, I look for it, and I find it, so I treat it and fix it. People's blood pressure gets better.
Sounds good to me.
Yeah. Anybody else? Great. All right. Let's turn over to Ms. Debbie. Thank you for your attention.
Thank you.
Yes.
She doesn't have to be recorded.
We're going to do it. Yeah. Here, I'll do it for you.
Okay, so what I do here at Sycamore Chiropractic and Nutrition, I'm technically the nutrition piece of that, but how I operate here is that he just talked to you about all the things that could be toxic in your world and all those things. So I am able to help you identify those things that are in your body and causing weaknesses in your system. I do that through something called muscle testing. I don't know if any of you have you heard of that? And what's really amazing about it is it's non-invasive, it doesn't hurt, and it's very, very accurate. So it uses your spine. Your spine has nerves that come out to all the organ systems, and it's how your body keeps in balance. It's the biofeedback loops are always at work in your body. Your body is made and created to heal and restore and stay in balance. So what's really cool about it is that as all these messages are being played out, and I want to give you just a really quick example. If you eat a good fat, which we all should because it's all our brain food, we all want to eat good fats. Good fats don't make you fat, and they're really, really good for you. Say you eat an avocado. So what happens there? This is a very simple explanation of it, but it will help me explain to you the importance of how all your systems work together, and that's what you want to look at. So you eat the avocado, your body has biofeedback, all goes up into your hypothalamus. Your hypothalamus tells your pituitary she's eating avocado, and we need to emulsify that fat. So what we do is we have, I tried to get away from that, and he's going to make me do it. So what happens is the hypothalamus gets the message, tells the pituitary then talks to your pancreas, and the pancreas sends out a hormone that tells the gallbladder to squeeze. So you have all of this amazing work happening, but tell me what happens when there is a breakdown in one of those pathways. Then maybe you wouldn't be digesting as well enough to have that good fat really work for you. So what I can do is using what we call dermatomes on the surface of the skin associated with those organ systems, I can put a little bit of pressure. This is your liver point. Go up against what we call a strong muscle, press on your arm. If your liver is mad, your arm involuntarily weakens because we're testing the autonomic nervous system. So it's really a very, very neat way to find out, okay, who's mad and why? Then we want to figure out the why. So I have what's called frequency kits or stressor kits. Everything has a frequency. If you have bacteria or pathogens in your body, if you have parasites in your body, they have a frequency. And so when we put these up against your body and muscle test, these are pathogens. So we have parasites, we have bacteria, we have viruses, we have fungus and yeast, mold type things. If I put that up against my body recognizes that frequency. I can muscle test, and I can identify then one at a time which one is it, and even go down. If you have an undiagnosed Lyme, I have a kit that has 25 or 30 different species of Lyme. We can really drill down and identify it, and then we know, okay, this is why you're having some of the systems you're having. So when it comes to, and then we also have one for chemicals and metals and foods. So we can be very, very precise about what's going on. It works really, really well for children because we don't have to hurt them. So, and it's one of those things we talk about why when you go to the doctor and you have symptoms of parasites, but then they come back and tell you you don't have parasites. And then you come in here and I tell you you have parasites. Why is that? Because they test for this many, species, and there are this many species, and you happen to fall in this area. You can't run from the frequency. It always will show up. So, and then what happens is we take the stress then off of your body by getting rid of those things that shouldn't be in there, as well the chemicals, the toxins. The main thing we want to do is keep your immune system hardy and strong and working really, really well for you. And ultimately, that is what we do for breast health. and for all other systems as well. So that's a little bit about what I do. Dr. Boynton talked about the supplements and how to know. Your body knows what you need and what you want. And so that's also what muscle testing does, is it helps us, because you could have the same person, you could have a person in the family that wants a certain supplement, and a child or a husband or whatever would want something completely different, because we're all what's called bio-individual. And so it's really a economical way, because I can tell you, do you need supplements or do you not need supplements? People come in with baskets of supplements because they go to my neighbor told me this is what I need to take. How many of you have heard that? And what's really encouraging to a lot of people is just with even one or two, if somebody comes in and their liver is overwhelmed with chemicals, a lot of times they leave with only 2 supplements from me. Something to take the chemicals, clear out the chemicals, and something to help strengthen the liver. And so 2 supplements can change your life if they're the right ones. So there are a lot of deeper things that go on as well, but so many times, especially the little ones, because we can fix them up pretty quick because they're not old and worn down. So it's exciting to be able to do that. Did you guys have any questions for me? It's a quiet group. No? Okay. If you have any questions, let me know. Oh, yes.
You said it can test for mold too?
Yeah.
Is it mold in your body, or like if you have a mold sensitivity, or what?
Both. This is, you can see on here, see these little things? How they, so that's, and this one is the fungus and mold. This is parasites.
So you hold that up to the body,
Yep. Just put it on.
and then,
Right, Kathy?
like, you just do each side, so there's 4 tests, or do you have to hold each little tube up?
Well, here's what we do. That's a good question. Because what I'll do is I'll put this whole side up against the body, and if it's a yes, then I drill down and find out exactly which one. For instance, on the parasites, there are 2 different kinds of parasites that we think of most. They're the wiggly wormy kind that lay eggs and multiply in your body. And then they're the amoeba type that's just a cellular, and those are just as destructive. And interestingly, we're during full moon right now. If you're seeing some weird behaviors in people, it might be that they have parasites, because parasites work with the full moon. It's really, is that ringing a bell?
Yeah, if you have joint pain that you didn't have last week, if you have symptoms you didn't have last week, you got parasites in you.
So but it's nothing to be alarmed about, because they're pretty easy to get rid of. You just have to find out that you have them. That's the biggest challenge.
It's
That
creepy.
and
It's creepy, but it is creepy. How do you get rid of them? Take a pill?
yeah,
There's supplements for it.
yeah, and it's always interesting to see, because that's what happened to me. The very first time I had done to me what I now do, they told me I had the wiggly wormy kind, and I was just along for the ride. I was going to support a friend of mine. I wasn't there because of me. But I'm telling you, that revolutionized my health and changed the whole trajectory of my life. And that's why I'm here today. I'm very passionate about what I do, because it's worked so well for me and now hundreds of people that I've been able to help. But it's a very common problem. People don't like to think about it, but it's very easily taken care of. You just have to stay at it. And there's a lot of people that think there are a lot of diseases that are, the origin is in parasitic stuff. And it makes sense if you think about it. They steal your nutrition.
Mm-hmm.
They disrupt all kinds of pathways. And it can be any symptom that you name. I could tell you that could be a parasite. That and Lyme, those are the 2 things that it's like, give me a symptom and I'll tell you that's what it is. So, thanks for that question. Anything else?
I was just gonna ask about mental health struggles, like, cyclical depression and things like that. Is that something that you can kind of help narrow down with?
I can certainly identify if there's a pathogen or something that's the root cause. Parasites cause a lot of disruption like that. A lot of little kids I see, they're mad. You know, they go through cycles of being really mad. They're obviously, one of the obvious things is to look in the poop and see what's in there. Because you can see if they're worms, you can see them. If it's mucousy and stuff like that, that's more of the cellular stuff. But if there are cravings for sugar, that's another sign because they want to be fed all the time.
Yeah.
So
yeah, worse behavior, anger, more mental health things monthly around the full moon.
and that's the greatest time to go after them because they want to come out and play during the full moon. So that's when we zap them. So, and there's gentle homeopathic things that I give the children, and then mostly herbals. You asked me about a pill. Herbals really work well for killing, which of course that's what the Lord gave us. So, anything?
That's great. What about if you did have cancer? Does that anything pick up with that?
You mean, what do you mean?
Just cancer and is there something that
I don't diagnose anything. If I found parasites, I wouldn't say, oh, this means you have
Right.
that. I don't speak that over anyone. I'm real careful with my words because I believe words have power. And so I would, if you were concerned about symptoms, I don't chase symptoms, I chase the cause and very rarely treat symptoms. The only symptom I go after is constipation because there are so many people that are so miserable. And so I'll say, okay, till we get your system up and running, we'll get everything else up and running. So that's usually what I do. Is that it?
Thank you.
You're welcome.
Thanks, Eddie. All right. I'll get you
Or just show me how to do it. He has the remote. And what's this for you? No. Oh. Yeah, point it at the computer and. Change it.
The TV.
Okay, all right, we'll figure it out. Okay, so the first thing I want to do, I just need one more hand. I just want to make sure that you're aware of everything that's in your folder, because sometimes people don't even look at the folder. And then, so in the front, it's going to be, you're going to understand what this is for shortly. It is how to get, if you're interested, the ebook TLC for healthy breasts. You're going to find out about that. And there's a coupon in there for thermography scans. There is an evaluation. We ask you if you wouldn't mind to fill out this evaluation. We don't charge anything for this, but we certainly appreciate your feedback. If you could take a couple of minutes and fill that out before you leave and give it to one of us, we would so much appreciate that. And there's also a brochure in there from the Women's Health Initiative Foundation. And long story short, they are a foundation that raises money for women who are seeking alternative, more holistic treatments to cancer. So that's all they do, is they raise money for that. So if you know someone who has, and it doesn't necessarily have to be just cancer, but they just don't have the resources to get well or find out what's going on with them, then they're the people to contact. You're going to find a lot of articles in here. You got breast anatomy. Dr. Boynton was talking about implants. Of course, doing thermography, we see the results of implants all the time. And let's just say, just don't do it. Just don't do it. And if you did, okay, there's lots of things that can be done. Explanting for until you can get there, help at a place like this, with the ultimate goal, hopefully, to be explanted. Lots and lots and lots of people are getting explanted right now, lots. Then we have an article on dense breast tissue, like Dr. Boynton was saying. A lot of times, doctors Well, women have been really scared by the allopathic world about dense breast tissue. For the most part, breasts have structures in them, and they're called densities. So whenever they go for a mammogram or whatever, and they're told, "I'm sorry, you have dense breasts," well, it's kind of like saying, "Gosh, your legs have bones in them. Sorry." So can it be a problem for some people? It can. And one of the issues, which I'm going to talk about soon, is if you've got a lot of densities in your breast, think about it as if you've got a lot of, what's that weed? It grows wild. Everyone's trying to cut down
Honeysuckle.
honeysuckle. If you've got a garden full of honeysuckle, air can't get through, sun, rain, nothing. So if you clean out the honeysuckle, then you've got a clear path. So that's what we're going to teach you about tonight, is doing a fluid exchange in your breast tissue. So we'll talk about that. So densities in and of themselves aren't necessarily a problem. And then we've got all kinds of things in here that you can do with essential oils. So at the end of the day, we just want to make sure that you leave knowing that there's so much that you can do to take charge and to achieve and maintain breast health. It's not just annual screenings and then putting your breasts in boob jail every day, and letting them out at night to breathe. There's a lot more that can be done. You like that one, huh? Okay, so let's see. I'm just going to assume it's this arrow. Okay, so I'm gonna talk to you about TLC for healthy breasts, and then Robin is gonna talk to you about thermography. Okay. Breasts go through a lot in their lifetime, and in this ebook you're going to find, what I'm going to show you is just part of it. We're just going to hit the highlights of this. So you're going to see proper techniques for massaging your breasts, pictures showing you how, written instructions, how and why breast massage helps with your lymphatic system, and then a special prize. Okay, so I'm going to show you. Basically, I'm going to be showing you, have any of you ever heard of myofascial release? Mm-hmm. Okay, so it's a slow, gentle movement or holding positions, and you're waiting for release. If you're in a rush, it's not going to work. You have to be patient, and if it hurts, you're going too far. Nothing should hurt. So if you're doing something like this and it starts to hurt, back off a little bit, wait for that to release, and then go a little bit deeper. So each one that I'm going to show you should take at least 2 to 3 minutes. And you might not have time to do all of this in one setting. That's okay. Just do 1 or 2 a day. That would be so much help for your breast health in general. Okay, so the upper body stretch and release. You can see she is laying on a pillow, kind of under her, she's got a pillow between her glutes and her neck, and she's just giving herself just a gentle stretch like that. And again, if it hurts, back off. If you feel any pulling and restriction, come out of it a little bit and wait. This should take 2 to 3 minutes, and all of this should be done on dry, bare skin, taking your time. Oh, well, pushing this is not going to work. You probably use this one. I don't know what I did to this now.
Jackie, move yourself back this way a little bit so you're in the camera. No. See where the camera's staring at you? There you go. When you're doing it.
Okay. So this one, it's going to be this. Okay. So we're going to pancake the breasts. So it's really easy. You're just going to take the flat of your hands, and you're going to kind of put the palm of your hands over the nipple and press. And press it slowly and go in as deeply as you can. Now I do this all the time, so I have no pain. When I first started out, it was uncomfortable. So now I can pretty much flatten my breasts. And then I'm going to come out quickly like that, so do a little quick fluid exchange. Okay. And then this one, it's called the breast jiggle. Very technical terms for this. And you're just going to kind of put I have no nails, so it's easy for me. And you're going to put your fingertips together like that, press them into the nipple as far as you can. You might not be able to go far, and that's okay. And then just jiggle. That's all you're doing, and it's a wonderful fluid exchange. Now, as soon as I start doing some of these, I get like a wave of goosebumps or a warm, tingly feeling. That's blood rushing back into my breast. Like sometimes if you take your bra off and you do a quick massage and you get that warm, tingly feeling again, that's the blood coming back into your breast or doing a quick fluid exchange after having been restricted all day long. Lift and separate. So we're just going to lift and separate like that. So it's slow, and if it hurts, back off and wait, and then go in deeper again. So you can do all of these sitting or laying down. It depends on the size of your breast. For you, we'll find out which one works best for you. So it's basically lifting and separating. So, you know, there's this underneath here, it's always in a crease, right? So we're just trying to release that crease for a while. Holding it like that. All of these things should feel very comforting and soothing. And if there's pain, eventually you're going to work all of that out. And this one, sometimes people get a little freaked out with this one. So you're just going to, I'm not going to do it, but you're going to grab your nipples and probably do one at a time in the beginning so that you can be really in tune to if it's painful or not. So you're just going to grab the nipple and pull just a little bit and see how far you can go. And over time, you're going to notice that, I know I'm getting some looks of, oh my God. Yeah, I know. But over time, if you can imagine, you'll get to the point where that doesn't hurt anymore. Then you know you've made change. We're trying to create space. We're trying to ease tissue and promote fluid exchange. So fluid, of course, being lymph and blood. And this is all for excellent breast health. Lifting and releasing. So this is kind of like telescoping. So you can do it like that, and then the motion is to lift it away from the body like that. Nice and slow. And you'll get better at this. Like you might find that there's a spot that's always sore, and then over time we're gonna go, huh, that's not as sore anymore. You're making changes. Between that and iodine, do you always suggest selenium with iodine? No? Okay, so the iodine seems to make a huge difference, like Dr. Boynton was saying, with fibrocystic issues. So you want to touch base with him or Debbie about that. Okay, and then this one is just kind of bracing the breast and telescoping the arm up this way too in the laying down position. And then one hand on the breast, and then turning the head, and then doing a stretch like this. You're going to feel that in all kinds of different places. The longer you hold it, the neat thing that happens is, if you're doing something like this, the longer you hold it, then you're going to say, why am I feeling it here now? And a minute ago I felt it here. It's because it's going to release in the order of hierarchy. So if it's super, the tightest area is going to release first, and then the second tightest one is going to release. So it's really powerful, but you have to stay with it, okay? Okay, let's see. Okay, breast cupping. So, and you can all take one of these home if you want to. Take one home for your girl breast, or one home for your blue breast, your boy breast, whatever you want to do. But you only need one, okay? And have you guys ever heard of cupping before? Okay, so it's the same thing. The best place to do breast cupping is in the shower, because you're usually got soap on or body lotion or something. So the whole idea of cupping, of course, I'm sure you've seen it, you know, just releases tissue. It's in Chinese medicine. Lots of people use it for different things. So when you're all slippery in the shower, I'm going to put a little bit of lotion on. I'm going to pretend that my arm is my breast. I'm going to put it on, and then it's almost too slippery. And then just slide. And I'm going to show you how to do that. So it's a cut fart. It's a really effective way of moving fluid. And this particular technique takes practice. Don't give up really quickly. I'm going to show you how to do it. But if you only do a couple of them, it's going to be really impactful, especially if you've got swollen breasts. You're going to do that really gently. Okay, whoops, losing all my apparatus here. So let's see here. So breast cupping. Being familiar with the terrain of our breasts is key to being able to notice quickly if there is a change, irregularity, or difference. So by doing breast massage, by doing breast self-check, which is in there as well, you're going to be able to tell if there's a difference for the better or for the worse. So you can deal with it right away at home. Like everyone, lots and lots of people have essential oils at home, right? Like frankincense is a great one for breast tissue. And if you do your daily breast massage with frankincense and coconut oil or jojoba or whatever, super healthy. Make sure you go into your arms as well when you're doing it. Okay. Yeah, so even at different times of the month, it's always a good idea to be able to recognize familiar lumps and bumps. For this reason, in addition to doing our monthly self-breast examination, adding regular cupping massage can help our lymphatic systems clear toxins, stimulate circulation, and loosen fascia or adhesions. Okay, so here is a wonderful way to stimulate lymphatic flow within your breast. Do this 1 to 2 times per week, and don't overthink this. Okay, like saying, "Oh my gosh, I don't have my manual with me. I can't do it." If all you do is this: pump, 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 massage, 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 massage. Do a little quick check. Do you have any areas that you were dealing with yesterday that you want to check in with, and do a little myofascial release there, and then pump, 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 pump. If that's all you have time for, then just do that. Forget about the rest. Okay? Just do something. Do something every day. Okay, so I'm showed you the pump. Then with the the other thing you could do. So let's say we did a little bit of massage, pump, do a little bit of massage, and then sweep up towards the armpit. Just do that a few times. And anyone who's breastfed, they've got these rollers. I should have brought it. They're breast rollers, and they look like rolling pins with knobbies on them, and they're about that big. And you can just roll out your breast too. If they're really fibrocystic, then that might not feel very good. But over time, especially if you work on your breasts a lot, that's what I do. I roll up my breasts every day as if they're not flat enough. You know, I just want to roll them out and just make that dough nice and flat, and then do this again, and then do the pump again. Am I moving too fast? No? Okay. Okay. Okay, so with your breasts still lifted, so she had her breasts up, you can cup several times from below the nipple to the bottom of the breast. So cupping, cup. You probably want to, lift it up a bit and then go down like that. Slide cupping, we talked that. Does everyone get what I mean by the slide cupping? Okay, both sides. And I'm going way too fast, of course. And then you see the arrows. I'm gonna go sweep, 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 and then sweep, sweep, sweep. And all of this is in the book. You're just going to become intuitive. This is like really detailed, and it doesn't have to be. And then you've got the coupon in there. Should you want to purchase it, great. If not, you've got enough knowledge now that you can do this on your own. If you do think you want to purchase the book, come and get a cup for free. I think. I think it's Robin's turn now. Anyone have any questions about that? Robin, I've warmed this up for you.
I do have one question. If you get a lymphatic massage, is that, they don't touch your breast, but they go right, does that help with, is that helpful?
Yeah. Yeah.
Depends on who you go to.
Oh, okay.
Some of
Some
them
of them
massage
do.
will do your breasts, yeah.
Okay.
So I do. So I'm also a massage therapist. I do lymphatic drainage. I also do breast cupping. So I went and got specially trained in breast cupping. So it's the vacuum therapies. So I've got cups that fit over the entire breast. It's the same premise as expressing milk, but instead it takes the whole breast and pumps and releases, pumps and releases. So it does a really phenomenal job at doing that complete fluid exchange.
Okay.
Did that answer your questions?
Yeah.
But you
So
you
some
know how to
people
do, pardon?
I said, so some people do. I just
Yeah.
wasn't sure that
Yeah.
that was a thing.
You, in Ohio, if you can prove that you've got the training to do it and you've got a license to touch,
Okay.
you're good to go. Our board here is, as long as you can prove it. So.
Okay, gotcha. Thank you.
I'm
Some
sorry.
little think you're just feeling somebody up.
Right? Right. All these women.
Okay, be good? You ladies want to stand up and stretch a minute? Or we've been sitting for almost an hour. You guys good? I think we need to stand up and just stretch a minute. Very important. Jiggle, 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 wiggle, wiggle, wiggle. Get the things going, right? The blood circulating, get the lymph moving.
I have a question before we shift.
Yeah.
At what age should we start doing this?
Doing what?
Breast massage?
As soon as you got breast.
Like,
Yeah.
So-
Get her comfortable with that. Because, I remember, I think I was 10, and I got the little buds, and, and that's breast tissue. So she can be doing this right now. And if she's getting into the habit of doing that and being comfortable with it, then it's just gonna become part of her routine, like brushing her teeth. So I hope she does.
Yeah.
And then thermography by 20.
okay. Oh, good. Okay.
All right, ladies, have a seat. Have you enjoyed it so far? Yes. Okay. I'm Robin Gobel. I work with Jackie. Both Jackie and I are massage therapists and thermographic technicians. Jackie has a bricks and mortar in Westchester where she does that, and she does her lymphatic drainage, she does her breast cupping, she does all of that there. I am her mobile unit. I get to travel around to different locations and offer thermography. So we're gonna get started. There's Jackie. She's already talked about herself. There's me. We're moving on. Besides being a licensed massage therapist and a thermographic technician, I'm also a certified integrative health coach. So I've always been in the inflammation business with massage and coaching, trying to help people to reduce that inflammation load in their body. Now as a technician, I get to detect it so that what are our next steps? What do we need to address first to start to get that body back into the health it needs to be in? So how many have heard of thermography before? Okay, so everybody's familiar with it. How many have had it done? A couple of you, okay. How many, I didn't get to see hands, how many have had mammograms? Okay, some of you are still kind of young, considering, the age that they say. But I'm gonna be talking a little bit about both of them, and then I'm gonna be showing you some slides on what thermography looks like, or what inflammation looks like in the body, what we can see through our infrared camera that we use. So basically we're using a FDA cleared type of modality to see inflammation, hot spots, or heat in the body. It's been FDA cleared since 1982 as an adjunct screening along with a different type of screening, whether it's mammography, ultrasounds, mammograms, MRIs, things like that. So there's just types of screenings. And I let everybody know, it doesn't matter what type of screening you get, It's a diagnostic tool. It cannot diagnose. A true diagnosis from a standpoint of cancer would be a biopsy. We're just looking at it from a heat and inflammation perspective. It's radiation free. So you guys are familiar with mammograms, right? We use those plates, and whatever's between those plates is going to be looked at, right? You're still missing breast tissue right along here, right through here as well. So we catch all of that when we do our thermography. So again, just it's safe, it's comfortable. You're not being compressed, you're not being touched, you're staying in front of an infrared camera. The only thing that's maybe a little uncomfortable is the room's kind of cool. It's 68 to 70 degrees. We have to do that to bring the surface temperature down on the skin. So anything that's heated, hot, it's going to come to the surface so we can see what's going on from that in that area. And we do more than just breasts. We have 3 different types of screenings we do. We do breast, which is 6 images. Then we have what we call a head and torso. It's from top of your forehead down to the upper part of your thigh. That's about 18 images, and it can see things like potential blocked carotids. Oral inflammation is a huge one. We've seen that, and I'll show you that. Bathe the thyroid, go into the lymphatic channels into the breast. TMJ issues, hormone imbalances. We've seen skin cancers that you couldn't see directly on the skin. So there's a variety of things that we can see. Hormone imbalances is a big one for women. Now people say, well, I've never heard of thermography. There's been over 4,000 published researches, articles done on it, and over 800 of them are on breast thermography alone. So as I was saying, there's other types of things that we can see in the body besides just breast health, right? Thyroid screening, hormone imbalances, vascular screenings, and other pathologies like that. Now, this is this is from 2020, but the numbers are still very high. 1 in 8 women will get breast cancer in his or her, I'm going to talk about men in a minute, her lifetime. So we all know somebody who's had some form of cancer, right? How many of we know that's had breast cancer? I know several. So out of that, estimated in 2020, 276,000 were diagnosed with breast cancer. In 2020, 41,000 deaths occurred from the result of breast cancer. By 2030, they're estimating 26.4 million will be diagnosed with cancer and 17 million deaths. That's from the World Health Organization. That's 17 million deaths too many, in my opinion. And we can't forget men. About 2,600 men a year will get breast cancer. Men are not void from breast cancer. Now, how many of you have been told by your healthcare practitioner that you have dense breasts? Dr. Boynton and Jackie both talked about dense breast tissue. What is it, about 60-65% of women on average, if not more, have dense breasts. So there was a law put into effect in 2015 called the Dense Breast Tissue Law. So if your provider suspects you have dense breasts, they have to let you know that, and also have to let you know that mammograms would not be the best screening for you, because what mammograms are looking at is already established densities. Okay, we're looking for heat, inflammation, hotspot. Cancer needs a blood supply. It gets hot. That's how we can see things earlier on. So if you have dense breasts, and cancer can also look dense. I may have an image in here for you to see that. Cancer, yeah, it's coming up. I'll just show you. There you go. Those are 2 breasts, both mammography screenings. This is a fatty tissue breast. This is a dense breast. There's cancer in both of them. I don't know if this has a little, no. You see where the red circle is in the fatty tissue? You can see that white spot there, right? And fatty tissue that's more easily seen, that is cancer. There's cancer up there in that dense breast tissue, harder to see. Like I said, with thermography, we're detecting heat. Cancer needs blood supply, gets hot. That's how we can see things happen earlier on. Now here's just different types of screenings. We've got the mammogram up on the top, we have an MRI, we have ultrasound, and then we have thermography. I'm just gonna brief through these as quick as I can, just so you can have, if you have any questions, we can answer those, and we can go back to these screenings afterwards. Now this is what it looks like. When you guys come see me or Jackie, we take it in what we call an inverse grayscale. The black and white, we do that so we can see the veins and the viscosity so much better. And our doctors at BTI, which is Breast Thermography International, turn it into the color palette based on the heat differentials going on. And we have different temperature thresholds throughout our body. There's about 8 to 10 of them in the breast alone. So let's say, I don't know what the numbers are, I'm just gonna throw it out there. So let's say the nipple is 0.3, that's threshold, okay? Your right nipple is 0.24, you're within threshold, but your left nipple is like 3.68. Obviously, it's hot. Something's going on there that we'd wanna further investigate, right? And a lot of times what our doctors will do is say, let's correlate that with an anatomical test, and they usually recommend an ultrasound. But this is the same person. This is the black and white, and this is what it looks like in color. So basically, this shows some excessive toxins and hormones created by heat in the breast. Now, everybody's gonna look a little bit different. Everybody has different vein issues going on. Now, this one here is showing a picture. I don't know if you guys can see this arrow. This woman has implants. Do you know anybody who's had implants and didn't want to do a mammogram because of the compression and the pressure? That's kind of scary, because the idea of what happens if that implant bursts or ruptures. This person actually went in for a mammogram, then came in for a thermography scan, and thermography detected that the implant had ruptured. She didn't know it, see it, or feel it. And going back to breast implant illness, like they talked about earlier, I have a good friend who had that. She was, I think she had the implants for 10 to 12 years before she got them out. She says within a month of her getting them in, she started feeling that herself. And then over that time, sickness, weight gain, a lot of weight gain, couldn't get it off. She wasn't as bad as some. She knew women that were bedridden from it. She's now been, I think, explanted 3 years now, and she's doing wonderfully. So, like Dr. Boynton said, it's the not fabric. It's
the wrapper.
It's the wrapper. Thank you. It's the wrapper that causes that. It's a toxin. Your body doesn't recognize it.
And it has a frequency.
It does. It does. So, this is the same person. This is the black and white on the left and the color, and this is them 6 months later. And you can see how it's, the color, when it shows warm, it shows a little yellow, a little red, depending on the temperature. These scans were taken 6 months apart. You can see the cancer advancing. See how it's getting hotter? So one thing with thermography is that it's a great way to map, measure, and monitor what's going on from an inflammation standpoint as well. So you come in today, get your scan, and let's say you come back 6 months later and get a breast scan. You had a full body done, you're addressing some of the issues that may be a little warm, you're going to the chiropractor for that, or dentist for some heat in the mouth. But the breast, we really want to monitor. Come back 6 months later, get that breast scan again. That creates that solid baseline. And there may be an ultrasound in there too, to correlate that, to see if it's seeing what we're seeing. That, with that solid baseline, kind of lets us know where you're at and what your normal is. And if it's gotten better, great, keep doing what you're doing. If it's gotten worse, what are our next steps? What do we need to do to improve that? Now, we have a lot of different types of breast cancers. This is talking about inflammatory breast cancer. This person came in February of 2012. I'm sorry, you can't really see it. There was some question in the right breast, a couple areas. She decided to do some alternative treatment, her choice. She went, she did a consult with one of our interpreting doctors, and they suggested to go see a surgeon about a mastectomy. So that was awfully a red flag. Something was going on that they said, let's really step into this and take a look at it. She decided to go a different route, which is totally up to her. She went to, where did she go? I forget where. She went to Spain for her cancer treatment. But she came back every few months to get scanned. This is February 2012, May 2012. You can see how it's getting hotter on that right breast, yellow and red. July 2012, you can see how it's taken over the whole breast up into the armpit. This is September. She passed away in January 2013. What if? What if she came back after that second scan and seen that that cancer was growing? What if she wouldn't have that mastectomy? would she still be here to tell her story? I have a dear friend, she's one of my best friends. She had 2 mammograms and an ultrasound. And they said, fine, we'll see you in a year. She says, no, I can feel it. There's something that was right above her nipple. Came in for a thermography scan and came back highly suspicious. Doctors then sent her off, I think, for an MRI. I think she did a 3D mammogram after that. She was diagnosed with 3rd stage lobular and ductal carcinoma. She had a double mastectomy. She didn't want to do the chemo route. She did 1 round of chemo. They talked her into it. Put her in a hospital for 6 days and took her hair 1 round. Oh, killed her. So she decided, I'm going to do it my way. She did it all holistic. She's 6 years cancer-free. And hers was stress-induced. You know, we can't quite pinpoint what causes it, but she's one of these kids that at age 2 was eating kale. I mean, she's always been a very good eater. Stress, family life, maybe some environmental toxins along the way probably contributed to her breast cancer. She was a health coach prior to this. She's now a certified cancer coach. She went back to school after this. I said, this was your purpose. God had a purpose for you. You had to go through this so that you could help people, and she's been doing that right and left and helping people through their journey as well. So, is your bra too tight? How many sitting here right now going, I wish this thing was off, right?
First thing I do when
Yeah, good, good. I always tell women, don't wear one if you don't have to. You know, if you work from home, don't wear one. If you are working and you come home, first thing you need to do is take that thing off, okay? And girls that are developing, I had she's now an adult, but when she was a teenager, she'd wear her bra to bed. Worst thing you can do. You've got to let the breast tissue breathe. Underwire bras, who wears underwire bras? Okay.
Not anymore.
Right. I was gonna say, I've got some alternatives to underwire bras that will help give you that support without giving you that restriction. Because what that does is that underwire sits under here and it sits where the lymph nodes are, cuts off the blood supply to the breast tissue besides, and that causes restriction. And as you can see here, this woman had her bra off for 15 minutes acclimating before her thermography scan. And after 15 minutes, you could still see where her bra line was.
Robin, do you still have that image of the inflammation right here?
I don't, but I was just going to bring that up.
Sorry, yeah, so Dr. Piano, who is like our grand poobah, he said oftentimes on the scans we see right here and right here, like hot inflammation areas, and that's as a result of the wires that you typically stop right there. And I've heard him say many times, underwire bras tear up breast tissue. So if you've got them, just throw them away.
Right.
There
So,
are some really good bras available too.
Yeah.
That give support.
Yep.
The
Ruby Ribbon is a bra that I wear, and I'm gonna tell some truth here. I didn't give up my underwire until middle of COVID. I knew better, but it's hard when you're so used to it and you feel that you need that, right? It's getting comfortable in your own skin and finding something that's going to support you without that restriction. So I'm sure you've all had your bras on all day. So when you go home tonight, your homework is to take off your bra and look in the mirror. If you have any red marks anywhere, your bra is too tight. Straps, obviously, we can adjust those. Bands, if it's not an underwire, you can go ahead and buy those band extenders and help with that. But once you take your bra off, do some of the techniques that Jackie showed you. Get that blood circulating back into the breast. That's precious tissue that we do not want to damage. Now, with that said, you have heard of Ruby Ribbon bras?
Just tonight.
Okay, it's in there. Great. I forgot it was in there. That's one bra, and I tell you, I've tried on all kinds of bras. Every Shaper Mint, Knix, everything I've seen on Facebook, I have bought them just to try them. Ruby Ribbon is what we call a braless bra, meaning it has a shelf. I think Jackie's probably got one on. I don't know if you're wearing yours today. I have one on. So, but what's nice with Ruby Ribbon is there's 5 levels, meaning there's what we call a lingerie level, which gives you, just covers you up. I wear the second skin, and then there's levels 3, 4, and 5, and I do have some samples here if you guys want to touch and feel them. But I want to feel like I'm not wearing a bra, and this does it for me. It still gives me, I'm not all that big, I'm just a C cup, but it gives me the support I need. I'm old, I don't care if they're up here anymore, right? But it still gives me the support I need without feeling like they're not being supported. Now we have levels 3, 4, and 5 that gives you more support, more tummy control, more back support for people, especially who are very large. Women who are very well endowed love Ruby Ribbon because they do give them that support. And there's probably some pictures in there of women before and afters, so we can talk about that later. I do have some that you can see. If you do want to get measured for them, just let me know. But we're gonna.
Sorry, Robin, I was going to say with the Ruby Ribbon too. The other added bonus about that is because there's this light compression. It's kind of like doing a little bit of lymphatic drainage all day long. It's kind of like Spanx. Okay, if it's too tight, then it's that's not okay. But with the kind of the whole body. Slight compression, if there is any puffiness or whatever, it's just kind of like wearing compression stockings, so it's good, and there's no tightness anywhere. There should be no tightness. And if you've got nothing else, and you're in the middle of changing out your bras, if you've got sports bras that are too big, good. That'll hold you over. The only time you want to be wearing a sports bra that fits the way they're supposed to be wearing is when you're working out. And you take it off because they are just too tight. But I often wear sports bras that are like 2 or 3 sizes too big, just to give you enough support, especially if you're wearing something loose and vague and you're out and about. So
It's okay, thank you. There's what a sports bra looks like, but it's been on too long. Obviously we need it if we're working out, right? We need some kind of compression so we're not hitting ourselves, so to speak. But this just shows you that there's still restriction in different types of bras. Now, thermography is used for more than just breasts, and we're going to kind of dig into that a little bit. Dental issues. This is a big one. This is huge, in my opinion. Did you just say who said they just had a tooth pulled? Okay.
Well, it was many years ago, but
Okay.
I did.
Yeah, you just did, yeah. Well, I have a patient who came in to see me post-diagnosis. She already came in after being diagnosed with, I can't remember what cancer, I apologize. She figured this out herself before she came in. She'd done some research and she was more on the holistic end. That tooth that had the root canal that failed her 8 years prior was the same tooth that represented that breast. She figured it out. So we monitor her. She does everything natural. So she comes in to see how she's doing with her treatment. But you can see here, you kind of show up. If you got a lot of inflammation in the mouth, it shows up really dark on our screen. And you can see how this is kind of leaching down, bathing the thyroid. This one is actually going into the lymphatic channels into the breast. And if your breast tissue isn't healthy, if you don't get that movement to help get those toxins out, it could sit in there and create disease over time. Here's another one just showing some thyroid gland toxicity being contributed from the bacteria in your mouth. So getting that tooth pulled, people say, well, I'm gonna get a root canal. You can talk to a lot of dentists, especially biological holistic dentists will tell you majority of the time they can't get that bacteria out. They give you an antibiotic or whatever. We have a thermography technician in the East Coast that used to be, she's a retired biological holistic dental hygienist. And Jackie and I have learned so much from her about mouth health. And a lot of times what happens is if you get a tooth pulled, you make sure you take that ligament out as well. Because if that ligament is still sitting in that hole, your bones start growing up around it and create a cavitation. And if that bacteria is still stuck and can't get out of the mouth, it can create toxicity as well. So there's a lot of things with dental. If you have something that's going on in your mouth and your dentist wants to kind of watch it, whether it's a cavity, whether it's some gingivitis, oil pulling is really good for that. Taking some coconut oil and swishing it in up to 20 minutes. I don't like the taste of coconut, so I'll put some peppermint essential oil in there, or some clove if I have some sensitivities. I'll put clove right on the sensitivity, and that's kind of like when babies, when we put that, what do you call that stuff?
Orajel.
Yes, yes, on there. Kind of does the same thing, but it's all natural. So, here is another image. You can see from the side profile how inflamed she is around her jaw area. That's from a post-root canal, and there was no symptoms. So we can see things before they're a pain or a symptom in some cases. This is skin cancer. This person came in for a thermography scan, and this came back and sent her off to a dermatologist. You couldn't see that on her skin because it was underneath the skin, and discovered that she had melanoma. I mean, look how big that is. That's her shoulder blades. It's probably this big. So again, thermography can see things before they become a pain or a symptom, which is very important as well. Severe inflammation. People say, well, how deep can you go? We can't go deep into the organs, but if the organ is inflamed enough, it's going to come to the surface from an inflammation standpoint, and we can see something's going on. For then we say, okay, let's further investigate that area and see what the root cause is. Up here, there's something going on. It could be liver related. This person, see this gentleman here? You see how red he is all the way through his forehead, all the way down his chin, into the right side of his armpit, down into the right side of his body. Anybody want to take a guess what that is?
Thyroid something.
Alcoholism. So, interesting. Now, how many people go to a chiropractor? This is really great for a chiropractor to see. As a massage therapist, I've worked for chiropractors 15 of my 20 years. So there's usually, and Dr. Boynton can correct me if I'm wrong, but there's usually 3 things that causes pain: lack of range of motion in the spine, it's subluxation, it's muscle tightness, because all the muscles from the back of your tailbone, your back of your neck, or your back of your neck, which is called your occipital, down to your tailbone, are all connected to your vertebrae in one form or another. So it's subluxation, muscle, or inflammation that you can't see or feel. So if you have a lot of inflammation going on, this is great to take to your chiropractors. They can go, okay, this makes more sense. Now we can start creating a treatment plan and protocol to help reduce that. This is the same person. It was 12 visits over a 12-week period, and every 3 weeks came in to see if the treatment plan was working. You can see the inflammation was so bad on the cervical and the upper thoracic that it was affecting into the arms, that's cervical. But you can see how the improvement was happening and the reduction of the inflammation in the body. And then, like I said, we can track treatment processes of, let's say, cancer treatment or other things going on. This same person over a 6-week period, start in March and then ended in May, about every 7 to 10 days came in to see if that cancer treatment was working. And you can see the reduction of the inflammation. Now you can't see and feel it looking at the skin, but we can see it from this standpoint. So, and then this is hormone imbalances. A lot of women will come in and they look like a leopard, got leopard prints all over. That's an indicator that there may be some hormone imbalances going on. And this is the same person, came back probably 6 months later and did some lifestyle changes, whether it was hormones, got her hormones regulated. Don't know the story, but you know, sometimes lifestyle changes, diet, sleep, stress, movement can all help as well. And there's just another way of monitoring lifestyle changes to improve the breast health especially. So, everybody's wondering, how much does it cost? Is it covered by insurance, right? It's not covered by insurance. It's not considered standard of care, but we do accept, we have a lot of women who use their HSA accounts, their FSA accounts for this. We do children as well, but breast screening is 6 images, it's $2.99. Head and torso is 18 images, it's $3.99. So from here is the breast, from here to here is the head and torso. For $100 more, you're getting so much more looked at. And then the full body is $549, and that does include a 15-minute phone consult with one of our interpreting doctors. So we have at least 3 doctors that look at your scans once we send them off. They're all thermologists, and then they do the written report. They send it directly back to you, so you get your black and white, your color, the written report, and then a link for you to do your phone consult with them. And that's it. Kind of whip right through there. Jackie, you want to add anything?
No? Any
Okay.
questions?
How often do you screen yourselves?
It depends, 6 to 12 months.
Initially, we like to do a 6-month window, especially for the breast, to create that baseline.
Yeah.
A lot of times, when it's full body, our doctors may recommend a year out, depending if you've got anything going on.
And sometimes the doctors will also recommend a correlation with another test, typically a breast ultrasound. And we're really fortunate. We've just partnered with this company called HerScan. I don't know if you've ever heard of them before. They're based out of Florida, and they travel all around the United States. They use hospital grade equipment, and they have certified sonographers, and they go to different locations, and all they do is breast ultrasound. So when you typically go for breast ultrasound in any other, like a hospital, a pro scan, anything like that, they only will scan the area of concern. But with HerScan, they do both breasts all over, $285, radiologist read. You can't beat it. You just can't beat it. So we're building up a territory here. They're going to be coming to my facility in April. We've got Tip City now. We've got Montgomery. We've got
Cincinnati west side of Cincinnati.
Yeah, there's 4 or 5, and we're going to keep building on it so that you don't have to be doing something that you don't want to do. Okay, so there's a wonderful documentary out there. If you like documentary, it's called Boobs: The War on Women's Breasts. It's kind of a funny name, but it's an excellent documentary, and it's done by MDs who really show you how well thermography and breast ultrasound work together, correlating together, because the thermography shows heat or lack of heat, and then the ultrasound is non-invasive and shows any masses that shouldn't be there. So it's awesome. Totally, so excited about this. I can't even tell you. Okay. So any questions about
What's the name of that company?
HerScan. HerScan. And if you go to my website, Mindful Wellness Medical Thermography, and sign up for my newsletter, there's always going to be notices about when they're, but in the meantime, you can just go to herscan.com. Find out more. Yes, ma'am.
Is a full body safe while you're pregnant?
Yes. Yes. Totally, 100%.